right before ASH, of course, we had the very best news in the UK. That is the NICE approval of Ibrutinib. Now, having the agent that we consider to be, the most effective agent out there that's licensed for the treatment of CLL and not having ready access to it in the UK was clearly problematic for many of us. There are now three of these agents, idelalisib, Ibrutinib, and Venetoclax, at least for the 17p patients out there. And what we have then is we've got three potential agents that we can be using and thinking about in treating our patients. And that allows us to choose the right molecule for the right patient based upon their other comorbidities, their other medical conditions, other things that are on, so that you can think about how do I find the right treatment for that right patient, rather than I've only got one approved that I can use and it's not necessarily the one that I think is right for that person. The clinical trial arena is full, of course, of now taking these agents which are licensed and looking at can we combine them. Now, for a healthcare system that's already constrained by financial difficulty, why on earth would we want to take a very expensive molecule and double or triple the cost by adding in other things? Well, we have to consider not just the cost this year, but the year after and the year after. And if there are ways that we can develop clinical trials where we can use these agents in combination and get patients off the drug, 2 years of two very expensive drugs together is still less expensive than 5 or 6 years of one drug on its own continuously. So that's kind of where we hope to go. So I think we'll see a lot more of the clinical trials looking at these minimal residual disease endpoints, asking the question, can we really eradicate the last cell and potentially stop the drug? Lastly, of course, there's continuing to be these trials looking at, is chemotherapy's day over for the majority of patients with CLL? Are we moving from an era of chemo-immunotherapy into an era of new targeted therapies? That still remains a clinical trial question, and it remains an important one that I hope our patients will think is important enough to want to continue to enroll in those studies.